COVID infections are on the rise in KELOLAND.
Yeah, the state is reporting 925 new cases and 75 hospitalizations. Now, tonight we look into the reason behind the increase and what a doctor says you should do.
It's easy to forget just how serious COVID was. The virus killed more than 3,000 people in South Dakota, the majority of them in 2021. Dr. Kevin Post, Avera's chief medical officer, says it's important to remember what it was like in those days.
I can remember walking through the halls of our intensive care units, our emergency room, just the volume of patients, the level of gravity of the situation of the patients they were taking care of, and the toll that took on all of our healthcare workers. I think those of us that lived through it will never forget how that felt.
Right now, it appears more people are testing positive for COVID. Both Avera and Sanford hospitals are reporting an increase in patients with the illness. The good news is the strains of COVID circulating right now are not as dangerous as the original virus.
In regards to the current strains that are circulating, do not seem to be quite as virulent, and they don't seem to be causing as much of a significance of an illness. However, we've seen a little bit of increase in cases here over the last month or so.
Avera had about 5 to 10 patients in the entire Avera system. Now they have just over 20 patients. Dr. Post recommends people take precautions, get vaccinated, wash your hands, and stay away from sick people if possible. And if you do get COVID, they recommend you simply isolate yourself for 5 days as best you can. Dr. Post says his level of concern is low to moderate.
So this is no means to sound, a flag of alarm or anything like that. It's just saying, hey, let's take our lessons of what we learned from the past several years and apply it to today so we can all live our normal lives with our loved ones.
Now, Sanford's chief physician tells us they have seen an increase in patients testing positive for COVID, but so far their hospitalizations have not increased. There are antibody treatments to help you fight off the virus and recover more quickly. Those with serious symptoms, of course, should see their doctor as soon as possible.